This is Chapter 2 in NUR 202, the Family, Culture, Spirituality, and Home Care. These are your objectives for this chapter. You can check those off as we go along because we will most definitely try to cover every one of these objectives. The family in cultural and spiritual context, family relationships with caregivers are influenced by culturally related health beliefs and spiritual values. We all have our own values and spiritual beliefs, just like we have our own cultures and ethnicities. Emphasis is on wellness and empowerment for the families. We need to give them some feeling of having a say-so in what goes on in their care. So we include them in our interpersonal care plans. Nurses need culture, competence, and understanding of spirituality, and we cover this again in another chapter subsequent to this one. Defining the family. The family plays a pivotal role in healthcare, representing the primary target of healthcare delivery for maternal and newborn nurses. It is the primary unit of socialization in families. It's a potent support system for its members. Hopefully, your patients will have family support. If not family support, close friends that can help them out when they get the baby and go home from the hospital. Family-centered care is the target of health delivery for maternal and newborn nursing. This is a picture of what we call the traditional American family or the nuclear family, and it's long been represented as a unit of a mother, father, and their children. Just think about where you came from, what kind of family you were raised in, and what kind of family you have now in your life, and how things have changed over the past few years. You can see a definition of all of these mentioned here on pages 15 through 16 in your books. This is a picture of an extended or multi-generational family. It's a family that extends beyond the nuclear family unit of the mother, father, and the children to include aunts, uncles, grandparents, and cousins, all living sometimes in the same household. Not that many years ago, this was the way people did it in all countries because that's just the way it was. We took care of each other, and now it makes you kind of wonder with times the way they are if it may not come back to that one day. Nursing homes seem to be hit hard with death when we have illnesses, so if they were at home, perhaps family members could take better care of them. I don't know. It all has to do with finances and insurance as well. Theoretic approaches to understanding families, family nursing. Nurses assist families as they incorporate the new member of the family as a new addition. We treat all families with respect and dignity. We keep them informed through communication. We need to keep in mind, though, the HIPAA laws so that we don't overstep our bounds and talk to the wrong person in that family, because sharing information to the wrong people can get you in trouble. So remember your HIPAA laws and refer family members back to the patient if they want more information about what's going on with the mother or the baby. These will be discussed in depth in Chapter 27 in your pediatrics class, Table 27.1 on page 703. If you want to look at these and read more about especially the family systems theory, that's the only one that may concern you at this time. Family assessment, the Calgary Family Assessment Model, or CFAM, is an assessment tool that can be used to guide in assessing aspects of families. This tool comprises 3 categories: structural, developmental, and functional. And we'll look at the next slide, or figure 2.3 on page 19 for more information about this CFAM model. This is the picture that's in your book, and you can see where it has category of family assessment and subcategories that are broken down quite exponentially. Graphic representation of the family. A family genogram is a family tree that depicts 3 generations of family members and their relationship to each other on both sides, the mother and father's family. An ecomap is a graphic portrayal of social relationships of the woman and her family. It may also help the nurse understand the social environment of the family and identify support systems that are available to them. You can purchase software to create these for yourself if you like. It's very interesting information to have to pass on to your children and then their children to have a family tree created. And this is an example of a family genogram. You can see this on page 19 in your books. And your echo map is on page 20. Cultural factors related to family health. Culture, shared beliefs, and values of a group play a powerful role in an individual's behavior, particularly when the individual is faced with a health issue. The effect of these influences must be assessed by healthcare professionals in providing health care and developing effective intervention strategies. Culture is not static. It changes as people change, and cultures adapt when interracial marriages or interreligious marriages mingle, then their culture has to adapt to the change. On page 20 in your book, there's a further explanation of these definitions, and you will certainly be introduced to subculture, acculturation, assimilation in your community health class that will be coming up, I think, next term for you guys. Cultural competence can be defined as developing an awareness of one's own existence, sensations, thoughts, and environment, without letting it have an undue influence on those from other backgrounds. Demonstrating knowledge and understanding of the client's culture, accepting and respecting cultural differences is very important. Most places that you go to work as a nurse, you'll receive a diversity training class. So be prepared to learn more about the culture and diverse population in the area in which you will work as a nurse, and particularly that facility where you're going to be working. Ethnocentrism is one's own way of doing things, thinking that your way is the best way and the only way, and we all know people who are very ethnocentric. Cultural relativism is learning about and applying standards of another culture, and this is the opposite of ethnocentrism. Childbearing beliefs and practices, communication, use of interpreters or translators, personal space, time orientation, and family roles. If you refer to and read the clinical reasoning case study on page 21, it's very interesting reading, and it might help clear up any questions you have about this subject. Communication is essential between the nurse and the patient. If you need a translator or an interpreter, then you need to get one. Most facilities have some sort of machine that translates, or red phones where you can get a hold of a translator, or there's even apps on your cell phone that help to translate. You must be certain that your patient is getting the care that they need in the hospital and at home. If they're just smiling and nodding at you, does that mean that they're understanding what you're saying to them? No, it probably does not. So you need to have a way to get feedback from them to verify that they are in fact understanding their discharge instructions and their prescription, and that they need to make an appointment. Cultural traditions define the appropriate personal space for various social interactions. Right now that may vary, as we have all been instructed to have a 6-foot space between us because of the transmission of this virus that's going around. Some families may live from moment to moment, so try making them understand the importance of making and keeping those appointments because those are made in the future and they may have a difficulty understanding things applied to the future. Their time orientation is not up to par. In many cultures like Mexican and Arabic families, the birthing experience is seen mostly as a female affair, and the fathers and grandfathers do not play a big role in that. If you look at Table 2.2 on pages 23 through 24, you get a better understanding of different cultural practices for childbearing and beliefs, and that is very interesting reading. This slide is about cultural competence. We have to recognize disparity exists, educate and promote healthy behaviors, apply abstract knowledge in practical ways, communicate respect for your patients, recognize the importance of different styles, anticipate addressing varied degrees of understanding. So recognizing that differences exist between one's own culture and that of the patient is very important. Educating and promoting healthy behavior in a cultural context that has meaning to the patient is essential. Taking abstract knowledge about other cultures and applying them in a practical way so that the quality of service improves and policies are enacted that meet the needs of all patients. Communicating respect for a wide range of differences, including patient use of non-traditional healing practices and alternative therapies. Recognizing the importance of culturally different communication styles, problem-solving techniques, concepts of space and time, and desires to be improved or involved with care decisions. Anticipating the need to address varying degrees of language ability and literacy, as well as barriers to care and compliance with treatment. Spirituality in the family. Caring for the spirituality of your patient is a component of holistic nursing. The International Council of Nurses Code of Ethics and the American Nurses Association Ethics Code both have statements to this effect. Please feel free to read these statements on page 25 in your book. And then the last thing on this slide is called the pause. The pause originated in an emergency room after the death of a patient, and it consists of a 1 to 2 minute time taken out to acknowledge the passing of a human life. And in many cases and many times you will see this being observed. Spiritual assessment. Box 2.3 on page 25 is a spiritual wellness self-assessment, and box 2.4 on page 26 you will find a spiritual assessment question list for your patient. Box 2.5 on page 26 is the FICA spiritual assessment tool. Take a look at those. The faith community nursing is known as parish nursing and is another opportunity to provide spiritual care. Parish nurses work through their church, synagogue, mosque, or faith community to promote health, manage disease, coordinate care, and assist with access health care through classes, home visits, and other types of outreach. These visits supplement community health nursing. They do not replace community health nursing. There's a growing demand for home care in the communities now. Many women would like to have an alternative to giving birth in a hospital, but with current healthcare system, it can seem impossible. As healthcare costs continue to be a problem, there's a greater demand for innovative, cost-effective methods of delivery of home care in the community. Telephonic nursing is becoming very popular, especially in the crisis we're in right now. Warm lines are telephone lines created to provide new parents with support, encouragement, and basic parenting education. Skype and FaceTime, as well as many other means, are available. Now there's Zoom as well, and several other things for communication and assessment in technology. Care management, first home care visit, assessment and diagnosis, and nursing considerations all become part of the initial assessment in the home. Home care maternal patients must meet certain requirements to be eligible for this care, and the health status of the mother, fetus, or infant is foremost in its assessment process. Available professionals to provide the needed care is also important. Family resources, including psychosocial, social, and economic resources. And then lastly, the question of whether it's cost effective. There are many things to consider before home care visits should be made. Home care nursing is a very independent field, and you are the one responsible for making sure that the patient can follow medication regimens and report things in a timely manner if anything should go wrong. This is the perinatal continuum of care. It starts with preconception and takes you all the way out through 12 to 14 months, including postpartum care and all the trimesters and labor and birth. If you look at page 30, box 2.6 for the protocol for perinatal home visits, you will see some of these things listed. You need to be very aware of your surroundings when you are going to do home visits. Sit in your car for a second and be aware that there's not a crowd of shady looking people standing over there under a tree looking at you. Just be safe. Watch out for any aggressive behaviors. If you can visit in pairs, that would be ideal. And always have access to your cell phone at all times for your protection. Infection control, you need to see the safety alert box on page 30 about OSHA, strict hand washing, personal protective equipment, and proper equipment necessary to prevent the spread of disease should be required for every person who goes into the home to do home care. The question is, when the services of an interpreter are used, it is important for the nurse to A, use any family member who can interpret, B, use an interpreter who is certified, C, speak only to the interpreter, or D, use an interpreter only in an emergency. The correct answer would be B, because a certified interpreter who has specific health-related skills and experience can help bridge the language and cultural barrier between the patient and the healthcare provider. This concludes this PowerPoint.